Everyone, I have a wonderful patient of mine. She is 6 weeks out from her explant, 360 cc's. Let me ask you a few questions. How are you feeling now compared to what you did before, like say 7, 8 weeks ago, 2 months ago?
Amazing. I feel absolutely amazing.
What is the biggest change you have thought that was the biggest impact, like how you improved, like that gave you a lot of freedom from the breast implant illness symptoms?
Oh, there's so many things that have improved. My headaches, I don't have any more brain fog. I don't have any more fatigue, shoulder pain, back pain. There's so many things. I can't even remember all of them, but I just feel amazing.
So no headaches?
No more headaches.
Right.
No.
Now, the other thing you mentioned that was very important, I've had a lot of patients that have gone to ENT for vertigo.
Yes.
How often did you get the vertigo?
Probably a few times a month. And it was the kind that would like totally make me have to sit down, and I live alone, so it was very scary for me. But that I haven't had it since. I haven't had it since the explant.
Sure. No, I have to say you have been my exemplary patient. You were very compliant with the upper arm restriction, limitation of movement, the T-Rex arms, the limit of the 3 pounds. So that's very good. How was your overall anesthesia?
Fantastic.
You remember anything from?
I remember nothing. I don't even remember going home, actually.
Okay.
But
sure.
It was great.
Now, next question that I always find the most interesting. How did you hear about me?
From one of my good friends. In fact, I had implants, and then she spoke to me about getting them. She got hers, and then she took hers out, and she told me how great she felt, and she was on me to get mine out, which I did.
Got it. And you know what I just heard from you? You prevented someone from getting them.
Yes, I did.
So that is very important. Just word of mouth alone goes a long way, not only to get the relief you need, but also to prevent the misery that someone was only going to sign up for, given the informed consent. Because again, just looking at the FDA warning, you would be surprised who would even want to think about getting them, let alone getting them. Now, next question for you. If someone says to you, this is all a placebo effect, this is all in your mind, that neck and back pain, those patients that have gotten neck injections, who unfortunately did not need them, and it was the explantation, what would you say to that person who says, well, this is all in your head?
Absolutely investigate. Go onto the Facebook group. There's so much information out there on our Facebook group, on Dr. Khan's Facebook group. Any question you could even imagine, and there's plenty of answers. The women are all wonderful and caring and kind, and they guide you the whole way. It's wonderful.
Sure. Now, one thing, what you said here indirectly earlier on was do your homework, do your research, so that you're well informed what you anticipate. You were well read, you knew exactly what to, and guided yourself very nicely, always being conservative and following the instructions. Now, next question, you did not need drains, right?
Right.
The last time I used drains was 2.5 years ago, and you did not need a lift, so how do you feel overall in regards to the drains and the lift?
I'm so happy I didn't have to have them, because I've read, in my research, I read about women who had the drains and how long they had to have them and how uncomfortable they were, and I cannot believe how I am so happy with how I look. I was afraid I was going to look like I did before my implants, but I don't know what you did, but I am super happy with no lift or anything. I will be able to wear my regular bathing suits, and I'm not going to have any underwear. I don't know how you did it, but
No,
it's
thank
wonderful.
you. No, thank you. Less is more, and in this case, all that surgery to do that lift and put a scar in the center of the chest, I think it's absolutely not mandatory. And even someone your age and with the 360cc implant, you overall did very well. Now, thanks for sharing your journey. One last thing that we must always talk about is, the psychological component. You had the anxiety, right? You had the panic attacks. Talk to us more about that.
When I worked out, I would, even just walking my dogs, and I work out a lot normally, but I got to the point where I was starting to have panic attacks because I couldn't take a full breath, and I couldn't figure out what it was. I thought it was something in my head and I needed medication or something, but as soon as the implants were out, just walking the depth of the breath I can take now is amazing. I can breathe good. I walk my dogs every day. I don't have any more of that anxiety of not being able to catch my breath.
Right now, this is very important. I have had patients driving their car all of a sudden have a panic attack simply because they couldn't take a nice deep breath. It's very similar or analogous to someone who's swimming deep underneath the water. And because you cannot gasp for the air and you're another couple meters more to go, that feeling of suffocation, that's what the patients describe, what they go through. And, you can only imagine the anxiety that's going to come along just from thinking of this, you know. So, no, thank you very much for sharing your journey, and take care, and hopefully this will motivate someone to prevent augmentation and to hopefully get explanted when done right.
Yes.
That's very important.
Thank you so much, Dr. Khan. I'm so happy. I'm so happy I found you.
No, thank you. Thanks for sharing your words.